Sprained ankle physical therapy program. Most ankle sprains are simple grade 1, mechanically stable, or grade 2, some joint laxity. Ligament sprains. Many such sprains result in persistent impairment. Although physical therapy (PT) often is prescribed for patients with grade 1 and 2 ankle sprains, PT's effects on recovery are unclear. Researchers in Canada enrolled 504 patients, age range 16 to 79, who presented with grade 1 or 2 ankle sprains within 72 hours of injury. Participants were randomized to usual care, medical assessment, instructions for home management of the injury, e.g. rest, ice, compression, or to usual care plus supervised PT, initial assessment. As many as 7 half-hour sessions augmented by a home exercise plan. In intent-to-treat analysis, the proportion of patients who reported excellent recovery, i.e., score of 450 out of 500 on a validated measure of foot and ankle recovery, at 3 months. The primary outcome was 37% in the usual care group and 43% in the PT group, not an statistically significant difference. Groups also did not differ significantly at 1 month or 6 months. Subgroup analyses by age and sex also showed no differences. No clinically important differences were observed between groups on any measures of ankle function. In this randomized trial, adding supervised PT to usual acute care in patients with simple grade 1 and 2 ankle sprains did not improve functional recovery for as long as 6 months after injury. However, an editorialist urges caution in interpreting these results, which conflict with a recent meta-analysis. Also, most interventions for ankle sprain focus entirely on the ankle. This approach might not be ideal in light of emerging evidence that ankle sprains affect movement patterns in joints proximal to the ankle, e.g. knee and hip, potentially leading to chronic problems such as ankle instability. The basics of high ankle sprains, syndesmosis injuries. About 10% of all acute injuries seen by physicians are to the ankle. Most ankle sprains are on the outside of the ankle. The ligament, connecting tissue, between the tibia and fibula is called the syndesmosis. This is injured during a high ankle sprain. The generic term syndesmosis refers to a joint where the rough edges of two bones are connected with thick connective ligaments. The syndesmosis between the tibia and fibula is a long connective tissue that is dense and helps stabilize the ankle joint. A high ankle sprain does not often occur in isolation. There are often other ligaments injured too. This may result in a longer healing time since multiple ligaments may be involved. These are the most severe ankle sprains and can be very frustrating for athletes, coaches, and trainers. At times, syndesmosis injuries occur along with fractures. This article is only discussing soft tissue ligament injury without fracture. Symptoms involved with a high ankle sprain that is isolated include point tenderness over the area of the outside ankle above the bony bump, pain as the person attempts to weight bear on that side, swelling above the ankle, pain as the upper part of the ankle is squeezed together stressing the injured ligament, pain as the foot is lifted up or rotated on the outside upper part of the ankle. In the workup for a high ankle sprain, X-rays are necessary to see if there are broken bones. The X-rays may also show the tibia and fibula separated more than usual if the ligament has been completely disrupted. If there is suspicion of significant disruption but X-rays look normal, stress X-rays may be needed. Who gets high ankle sprains? Around 10% of all ankle sprains involve a syndesmosis injury. Sports that involve quick changes in direction or lots of jumping are prone to these injuries, including soccer, basketball, football, and volleyball, or skiing. In skiing, for instance, during a fall a person's binding may not release, which can cause the initial ankle ligament injury and then travel up higher into the syndesmosis. At times, the syndesmosis sprain is missed and is only noticed when conventional treatments are not working in a satisfactory time frame for getting the athlete back in the game without pain. Syndesmosis injuries typically take twice as long to heal as regular ankle sprains. Treatment for a high ankle sprain does not differ that much from a lower ankle sprain. It just takes longer to heal. Initial treatment with a walking cast or boot may help a lot as the initial part of PRICE. This stands for protection, rest, ice, compression, and elevation. Anti-inflammatory medication can help along with intermittent icing. Physical therapy may help substantially with decreasing swelling and inflammation. There are some electrical stimulation methods and ultrasound that have been in use to help these injuries heal faster. The research done on these techniques has not shown definitive help, though. As with regular ankle sprains, severity will vary. If the ligament is disrupted severely, the ankle will have instability and will need surgery to prevent chronic pain. The surgery for a syndesmosis disruption is not overly complicated. 1 or 2 screws are put across the region from the fibula into the tibia to stabilize it in a proper alignment. Then after 6 weeks or so, the soft tissues will have hopefully scarred down and the screws can be removed. Then slowly the patient's rehabilitation can increase activities.